Welcome to the 8th edition of the Lung Cancer Europe Report. This report explores the financial burden of lung cancer as reported by people impacted by this disease. 1,161 participants across 28 European countries have shared how lung cancer impacts their finances. Let's first look at the cost of lung cancer and the impact on personal finances. Most participants experienced both medical and non-medical expenses because of lung cancer. The costs reported most often were travel for medical reasons and personal items like dressings, bandages and creams. In addition, 6 out of 10 experienced income reductions since their diagnosis, mainly because of salary loss. Financial difficulties were more frequently reported by caregivers. What financial repercussions were experienced because of lung cancer? Almost half of the participants had difficulties paying expenses associated with lung cancer. 1 in 3 found it difficult to live on their usual household income. And 1 in 5 used more than 30% of their household income to pay these costs. Let's now look at the repercussions of financial stress on health. Most people experiencing financial difficulties stated that at least one sphere of their life was negatively affected by the economic repercussions. Mental health and lifestyle were the 2 spheres most negatively affected. 8 in 10 perceived the financial difficulties to be a barrier to treatment and care. Our survey found that 1 in 4 respondents, both those with and without financial difficulties, had made decisions that affected their self-care or adherence to treatment due to financial pressures. Also, a substantial number of participants reported that their personal finances influenced their access to supportive services, early or rapid diagnosis, and innovative treatments. How did participants deal with financial toxicity? The main support was received through loved ones, followed by public healthcare and social support. Worryingly, many reported not receiving the assistance they needed from public services. One of the best strategies for improving access to financial support is channeling information through healthcare teams. However, only 1 in 4 discussed finances with their healthcare team, and only a few did it frequently. Social workers are considered to be the most appropriate individuals equipped to handle these conversations. However, only 17% of people with financial difficulties had ever spoken with social workers or discussed their situation with social services. Call to action. Healthcare teams should screen for financial toxicity and provide programs to assist with costs if financial vulnerability is detected. And authorities should increase income replacement program coverage for people unable to work because of lung cancer or caregiving. Lung Cancer Europe. Many faces, one voice.